afternoon, everyone. I'm really excited to talk about my fellowship and some of those findings, because what I did find is that Australia's a little bit behind the rest of the world. And I kind of feel within the next 5 years, we're going to be catching up. So really what I want people to kind of think about while I'm talking is about, and this is my new catchphrase that I'm using, is how can we future-proof our students? Because it's kind of not here at the moment, but it's coming, and particularly and my presentation is very much around health and the healthcare environment, and how we can ensure that our graduates of nursing, of aged care, in the community health services sector, how can we prepare them to work in this digital age? My fellowship took me to America, it took me to Chile, and it took me to New Zealand. And a lot of people said to me, Chile? You actually went to Chile? Because mine was all about health informatics and how they've actually implemented health informatics and technology into their undergraduate nursing curricula. And I can tell you, when I went to Chile and America, I actually felt like we were a third world country as compared to where they were at using technologies. So essentially, we're in a real the world's changing dramatically. Worldwide, the healthcare industry is undergoing a radical transformation. Organisations are going to be required to adopt both technology and process improvement strategies to enable that there's secure access, exchange and analysis of patient information, and to also create greater efficiencies in both business and clinical processes. We have some of this, we have bits and pieces around Australia, but not a lot of it. What I found when I was overseas, there are lots of technologies to support people in the home. There's a move to mobile health, telehealth using mobile apps for data, and wearable technologies. There are digital hospitals, and we have a couple here in Australia that are fully digital, which means they're completely paperless. They're wireless, integrated communications, there's tracking of equipment, electronic medical records. What I found, I went to a presentation and they were talking about, it was on a digital hospital that was here Bendigo is getting a fully digital hospital. I think it might have even opened. So with that, this presentation, they were scanning people's ID bands. So if anyone's ever been into hospital, had someone been in hospital, you've got your identification band. That now has a barcode on it. Nurses go along, scan it with their phone, all your data comes up on the phone. So there's no going to the notes at the end of the bed or out where the station is. It's all there on the mobile phone. At the end of that presentation, I kind of felt like this was a James Bond movie, all these technologies that are going to be appearing very soon. And so it's kind of thinking, and then when I was overseas, in Chile, I was taken to a digital hospital. So I was expecting it was like our digital hospital, and there'd be patients. I've walked in, it was a call centre, with nurses sitting at computers, screens up everywhere, and patients were at home. They had over 200 patients sitting at home with these wearable technologies, wireless technologies. They would take their blood sugar for those with diabetes. They'd take their blood pressure. They would also take, if they were on blood thinners, what their blood count actually was, and then it would be transmitted to this call centre. So the nurses there would then be making decisions about what was coming through, and what needed to happen. Did they need to refer that person on to a doctor? Did they need to send them somewhere else? And that was all via phone and email. So they didn't actually see someone, but this is what was happening. So how are we preparing our students to work in that environment? Still have really good assessment skills, but using that technology without seeing someone. Then we also have electronic medical records coming through. Overseas, and that's your e-documentation, so that your health records, some of you here may already have your own electronic medical record. Overseas, 80 to 90% in America, Central South America, are using the electronic medical record. Australia, as of yesterday, 20% of us are using it. So that's a big difference. We have some hospitals that are piloting. So some of our public hospitals have been piloting using different medical records. Some of the private hospitals are just about to start. The issue is we have all these different vendors, so they don't speak to each other, to different hospitals. So if you go to one hospital here and then go to another one, say if you're in the Northern Territory, something happened to you, it won't read each other's. So there's some of the issues with our medical records at the moment. So in 2008, Australia started talking about a strategic framework and guide for national coordination and collaboration in e-health. They established My Health Record, but as I said, only 20% are currently using it. In Australia,